Back to you.
Thanks, Nick. COVID-19 variants continue to cause concern here in Minnesota, especially as we head towards spring holidays and spring break, which are typically big times for large gatherings of family and friends. KGTC's Sarah Gannon joins us live in the studio with the latest from the Department of Health. Sarah.
Well, Caitlin, the Minnesota Department of Health says the more the COVID-19 virus circulates, the greater the chances for it to mutate and create more variants.
A total of 317 cases of the B.1.1.7 variant have been identified in Minnesota.
We are actively looking for variants.
This helps the Minnesota Department of Health understand how the virus is spreading and identify hotspots.
These include the Southwest Metro, Carver and Scott counties, the Mankato-Blue Earth area, and St. Louis County.
Within Minnesota, there has also been 73 confirmed cases of the B.1.4.2.7 and B.1.4.2.9 variants that were first identified in California, 3 cases of the B.1.5.1 variant from South Africa, and 2 cases of the P.1 variant from Brazil.
We are currently working towards sequencing 550 samples per week by the end of the month in partnership with the University of Minnesota Genomics Center. Right now, we're doing about 300 samples per week in the public health lab, and we may be increasing our sequencing even more in the coming weeks.
Infectious Disease Director Chris Ayersman warned about pandemic fatigue, and a recent report from the University of Washington showed a decline in percentage of Minnesotans in consistent mask wearing. The report projected if we can get our mask coverage up to 95% in the next week, we could have upwards of 140 fewer deaths by summer.
Minnesota is at a key point in the course of the pandemic. More and more people are getting the protection of the vaccines, but there are still many who are not yet vaccinated. And as we know, it does take a number of weeks to build up full immunity between the multiple doses for the 2-dose vaccines, as well as 2 weeks after the final dose to reach full protection.
I can't emphasize this point enough. We are in a race between the variants and the vaccine, and the decisions we all make in the next few weeks will have a lot to say about the outcome of this race.
Now, when it comes to celebrating holidays like Easter, Passover, and Ramadan this spring, things will continue to look different as large gatherings are still highly discouraged, even if you have been vaccinated. Tom, Caitlin, back to you.